some effect on your ability to think, remember, and learn new information. There are also many physical effects from cancer that can lead to thinking changes. These include anemia. If you're anemic as a result of your cancer, this affects the amount of oxygen that gets to your brain and your general ability to think and remember. If you have an infection, particularly an infection in your central nervous system, can lead to changes in your ability to think. If your cancer treatment brings on early menopause, we know that menopause has many memory problems associated with it. There's some research to show that, and that's if you're susceptible to it. But during the period of menopause, there can certainly be some cognitive changes. And finally, if there are any nutritional deficiencies as a result of your cancer, either because you can't eat or keep anything down, or depending on the kind of cancer you have, there may be some associated nutritional problems. Those deficiencies can lead to certain cognitive problems as well. Now, cancer is also very stressful, and many people with cancer experience anxiety disorders, depression, and some even have post-traumatic stress disorder. Quite a high number of patients in the clinic where I'm at, in the bone marrow transplant clinic, actually experience PTSD simply because it's such an intense and difficult treatment to go through with many multiple stressors and not knowing if it's going to even work, if you're going to survive. And when you go through something that life-threatening, that can lead to symptoms like nightmares, flashbacks, feeling scared at the thought of coming back to the hospital, or panicking when you see the hospital from a distance. All of those symptoms are sort of indicative of post-traumatic stress disorder. And we know that anxiety, depression, and PTSD all have effects on memory and the ability to think and processing speed. And once they're treated, that you'll start to see improvements as well. One sort of interesting note is with PTSD, or post-traumatic stress disorder, there's actually been some recent research to show that the hippocampus, which is a structure in your brain that is often associated with memory, can shrink as a result of the trauma that you experience, and then can actually improve after treatment, after the other symptoms are treated. So there can be some temporary thinking changes as a result of the stress that you undergo from your cancer treatment. Finally, memory changes can happen as a result of insomnia, not getting enough sleep or poor quality sleep, and the fatigue that you experience with cancer. In fact, if you're sleepless for a long period of time, you can actually appear to have brain damage. That it can be so severe that you can't remember, you can't process, your processing speed becomes very, very slow. So all of these things taken together can have a significant impact on your ability to think, remember, and learn. And that's what we're looking at in terms of what we call chemobrain. So there are many causes. It's not just chemo. And some of these are temporary and some may be permanent changes. It's hard to know, though, because there's similar symptoms for many different causes. So what we have to try and do when treating these cognitive changes is look for the underlying cause. So this requires that your doctor, your psychologist, or your therapist all work together to help identify some of these causes. So even if you go to a neuropsychologist and you notice that there's been some cognitive changes after your treatment and you get tested for your memory, it can be very difficult to determine why you're having these changes. If you're feeling depressed, if you're feeling stressed, that can impact your performance as much as a permanent change, such as damage caused by a central nervous infection. So we don't really know right away. It does require some patience to figure out whether these changes are going to last or whether they're going to improve when you improve other things. So in some cases, the improvements can take up to 2 years post-treatment. So from the time you stop your chemotherapy and your other cancer treatments, a good 2 years, surprisingly. And that's if you get everything else on track. This can make returning to work quite difficult because you can get the okay to go back to work because physically you may be okay, but the cognitive changes may take a little bit longer to sort out. So depending on what you do, the kinds of changes that you experience as a result of post-chemotherapy treatment may or may not impact your job. For example, it would be very difficult if you were a waitress who had to remember multiple details. You have to multitask, keep orders in your head while getting coffee, and a very sort of busy kind of job where you hold multiple details in your head. That's going to be more difficult actually to return to work than, say, if you were a CEO of a company. If you're a CEO of a company, you presumably have administrative support, you have VPs who can follow through on different projects, you have people to remind you of whose names they are or who you're meeting next. You have lots of support to actually help you get through your day. And because your general intellect usually isn't affected by chemotherapy or cancer treatment, you can actually manage with those supports. So it can be surprising. It really depends on the kind of job that you have, whether or not you're going to experience more or less difficulty or whether accommodations can be made. So in some extreme cases, you may find you actually need to change careers because it will be overwhelming for you and difficult to carry out your work activities. And in other cases, it might just require a few simple modifications in order for you to be successful. There's a couple of different ways. I'm going to talk at the end about where you can go for help, but I'll quickly mention here that depending on where you work, you might be able to get help from your employer. Either if it's a larger company, they may have an occupational health department that's able to assist you with accommodations, or a referral to an occupational therapist who is able to help with work simplification and making your job more doable. They analyze, what an occupational therapist does is analyze the tasks that are involved in your work and look at ways of making you successful, either modifying the job or getting you memory aids or teaching you strategies so that you're able to do your job. You can also, if you're on disability, these services can sometimes be obtained through your disability insurance company, such as Great West Life or Sun Life. I don't want to promise anything, but you can certainly talk to your caseworker if you have one about assistance with return to work issues and whether or not there is someone who can help you with cognitive enhancement strategies for returning to work. And barring that, sometimes you may need to go on disability insurance if it's a permanent change. But again, we don't really always know that until 2 years after the fact. So I'm going to quickly go through some different treatments that are used. So assuming that we've identified the underlying cause, if it's anemia, then you treat the anemia. If it's insomnia, then you get on a good sleep program that helps you cope with your sleeplessness. So assuming that we've treated the underlying cause, you've gone to a therapist, you've treated your depression, and you still have residual memory changes. You still have things that aren't quite what they used to be. I'm going to go through some of the things that you can do to help improve some of the thinking changes that occur as a part of your cancer treatment. So this is fairly experimental. Some people are looking at using medications to treat the memory problems that post-chemo patients experience. Now again, a lot of the symptoms that I described being part of this condition are very similar to the symptoms that kids and adults with attention deficit experience. And so some people have thought, well, the medications that we use to treat ADHD might be useful in post-chemotherapy. So again, you can talk to your doctor if you're interested in trying something like an an ADHD medication. There's also some experimentation with Alzheimer's medications, some things that help Alzheimer's patients keep their memories for a longer period of time. So again, you have to talk to your oncologist or your family doctor. They can refer you to the appropriate specialist who feels comfortable trying out some of these medications for these use. So that's a more experimental area of treatment.